Listen closely because what you're feeling is probably not what you think it is. Most people assume it's the spine, a slipped disc, a pinched nerve, something serious. But very often, it's none of those. It's a small joint right at the very base of your back, and it's simply gotten stuck. Today, I'll show you how to tell if that's what's going on and 4 gentle moves you can do today on your bed to help it settle. Most people have never even heard of it, and it's behind a huge share of one-sided low back pain. One honest thing first, if your pain shoots below the knee or there's numbness or real weakness in the leg, don't do these moves. That's a get checked sign. And if you already have a back diagnosis, run this by your doctor first. Alright, so how do you know if it's this little joint and not your spine? First, the pain sits low, right down at the base near the belt line. It doesn't climb up your back. Second, it's on one side, just the right or just the left. It doesn't cross the middle. Third, it can travel into the buttock or the back of the thigh, but it stops above the knee. It doesn't run down into your foot. Fourth, it flares when you stand up, getting out of a chair, climbing out of the car, going up the stairs. And fifth, this is the one people always nod at. It eases off when you lie down, sitting quietly, lying flat, and it settles down. Sound familiar? If you're nodding along, there's one more little test. Stand up. Put your hands on your buttocks right over the sore spot and gently lean back. Arch backwards slowly. If that reproduces your pain right there at the base on one side, that's your answer. Now do me a favor, tell me in the comments which side is yours, left or right. I read those and it helps more people than you'd think. Still with me? Good. Let's look at why this happens. The muscles around your buttocks, the left side and the right start pulling with different tension. One side gets tighter than the other, and over time that tighter side turns one half of your pelvis a little forward rotated relative to the sacrum, the bone right in the center. That small forward turn is exactly what jams the joint. That's the whole problem. One side rotated forward and stuck. Good news is we can work on it. That's exactly what these 4 moves aim to do. They rebalance the muscles around the pelvis so those bones can settle back home. Let's do them together, nice and easy. For the first move, you'll need something firm to squeeze between your knees. You'll need a yoga block, a thick hardcover book, or even a plastic food container if it's the right size. A food container can actually work well because it has a suitable shape and firmness. Lie down comfortably on your back. Bend your knees at a 90-degree angle and place the block the long way between your knees. Keep your heels together. Now give that block a firm, steady squeeze with your knees for 10 seconds. Don't be surprised if you hear a little click or pop in the pelvic area. That's completely normal. It's just the joint releasing pressure. After 10 seconds, take a deep breath and relax. Once you've done that, turn the block to its narrow side. This shifts the focus to a different set of muscles. Give it another 2 to 3 squeezes, holding each one for 10 seconds and relaxing just the same. Now, the second move, and this one is different. You only do it on the painful side, only the sore side, not both. Stay on your back. Reach down and grab the leg on your sore side with both hands and draw that knee up, aiming it past your shoulder, not straight to your chest, up toward the shoulder on that same side. The magic is at the very end of the range. Pull it as far as it comfortably goes. Give a gentle little tug at the top. Hold for a second or two, then ease off. Do that 15 times. Now, you may notice something. Compare it to the other side sometime. The good side usually pulls up easy. The sore side feels tight, like it hits a wall. That's the one we're working, so we only do it here. One caution. If you feel a sharp pain in the groin when you pull, stop this one. Skip it. That sharpness means the hip joint itself is tight, and this isn't the move for it. No pushing through that, and keep the other leg down. Don't let it lift off the bed as you pull. If it keeps rising, have someone gently hold it down for you. A helper can even press lightly on top to deepen the stretch. Gently, and stop the moment it feels sharp. 15 slow pulls. That's the goal. It coaxes that forward rotated side of the pelvis back where it belongs. That's why we leave the good side alone. For the third move, grab a stick. A broom handle is perfect. Something firm, a wooden dowel, a rolling pin. Firm, not floppy. Soft won't give you anything to push against. Lie back again. Pass the stick between your legs up close to your knees. Lift your legs to a right angle and hold that stick tight with both hands so it can't slip. Now press your legs outward against it, like a pair of scissors trying to open. Push out and hold, count to 10, and relax. 5 times on this side, then switch your legs, one over the other, and press again. This one's a quiet hero. It balances the tone of the buttock muscles on both sides. That side-to-side balance is half the battle. Now, the fourth and last move. This one's asymmetric again, the sore side only. Let's say for me, the left side is the sore one. Lie on your back, reach up and grab the good leg, the right, with both hands, pulling it toward you. Your arms and that bent leg make a triangle. That triangle steadies your body. Bring the sore leg's foot in close to your buttocks. Now, holding that triangle firm, lift your hips up toward the ceiling. Then come down slow, barely kiss the bed, and don't let the muscles switch off. Right back up. Reach the top, hold there a second or two, and lower again slow. 5 times through. If it feels easy, go up to 10. Watch your form here. The lift comes from the hips, not a yank from the arms. Slow up, slow down. This is the hardest of the 4. If it's too much, or you've been told you have osteoporosis, do a smaller lift or skip this one entirely. There's no prize for pushing, and if your whole body shakes a little, that's the muscle finally waking up. Just don't force it and never push into sharp pain. Alright, that's the routine. 4 moves. Now let me answer the questions I know you're about to ask, because I've heard them 100 times. First one, it felt worse afterward. Did I do something wrong? Usually no. A little muscle soreness after new movement is normal, like any muscle you haven't used in a while. But there's a line. A little achy and stiff, that's fine. Sharp or shooting pain, that is not. That's your signal to stop. Don't grit your teeth and push through. Moving gently is good. Forcing it is not. Next, what was that pop? It scared me. I get it. That sound can be startling, but that click is just gas bubbles releasing inside the joint fluid. Same as cracking your it is not bones grinding. And here's something most people never hear. The pop is not the goal. Plenty of folks get better and never hear a single sound, so please don't chase it. Don't crank or twist your back trying to force a crack. These moves let the joint settle on its own. That's the whole idea. Gentle wins. Third question, the big one. Are you sure this isn't a slipped disc? Let me give you the clearest difference I know. A disc problem usually fires a sharp electric pain all the way down past the knee into the foot, often with numbness or the leg giving out. Our joint pain stays up high, one side above the knee. So, if your pain shoots below the knee, if you've got numbness or weakness in the leg, or, and this matters most, any trouble controlling your bladder or bowels, this is not the video for that. That's a get seen now situation. Please don't wait on it. For everyone whose pain stays high and on one side, you're in the right place. Fourth, how do I keep it from coming back? Stop sitting cross-legged the same way every time. Switch it up. Take the wallet out of your back pocket. Swap the shoulder you carry your bag on. And after these exercises, don't spring up and rush around. Give your body a quiet minute to settle. Small changes, but they're what keep that pelvis level. Fifth, and a lot of you have been waiting for this one. I'm older, I've got arthritis, wear and tear, a bad back for years. Is this okay for me? Here's the honest answer. For this kind of pain, physical therapists point to gentle pelvic stabilizing exercises as a sensible first step. And age by itself isn't a reason to skip them. But you know your body. If you've got a real diagnosis or anything feels off, check with your doctor first and let them tailor it to you. Go slow. Use your hands for support. There's no prize for rushing. And last, how long until it works? Be patient with it. Twice a day for 2 to 3 weeks. Not once and done. And here's the part people skip and then regret. When the pain eases, don't just stop. I've seen it again and again. Folks feel better, quit the routine, and it creeps right back. Keep going a little longer than you think you need to. Let it stick. So, that's the plan. 4 gentle moves twice a day. Give it a couple of weeks. One last word. This is a teaching video, not a replacement for your own doctor. Be gentle, go steady, and never push through sharp pain. You've already done more than most people just by staying till the end and learning this. That tells me you're going to take care of yourself. Tell me which side is yours down in the comments, and I'll see you in the next one. Take good care.